said already, the President of the Philippine College of Surgeons, Dr. Joby Villaflor, who trained under Secretary Ted Herbosa in Jose Reyes Memorial Hospital, and another protege of Secretary Ted Herbosa, trained under him also in the PGH, is Dr. Rodney Dovitas, Deputy Director of the Philippine General Hospital. Wow. And let me acknowledge the presence of the Vice Chairperson of the Asian Hospital, Dr. Roel Azores. Palakpakan natin, Dr. Roel Azores. We have many doctors in today's Kapihan sa Manila Hotel. And lest I'll be scolded by my brother if I do not acknowledge him. Let me acknowledge the presence of Mr. Bert Lina, the logistics man of the country. Bert Lina. Let me pay a tribute to all our members of the media. This is the first Kapihan sa Manila Hotel this January. Salamat sa lahat ng members ng media, including social media. We have bloggers here also, from the conventional media, from television, radio, and print. Maraming salamat. Now, we have Secretary Sani Coloma. Palakpakan natin. The publisher of the Manila Bulletin. Okay. So, palakpakan natin ang members ng media. Palakpakan natin. The country owes a lot to you because you provide the link between the newsmakers and the public by providing all the needed information so people can make their decision based on facts and based on information. So, we will begin this Kapihan sa Manila Hotel. Magandang umaga sa inyo. Ako si Joey Lina. I'm the chief waiter here sa Manila Hotel. I've been here for the last 17 years, 3 months, 17 days, 8 hours, 50 minutes, and 30 seconds. That's how long I have been here. But, okay, let's begin. Sounds like a song. Okay. Mr. Secretary, first, congratulations on being appointed as Secretary of the Department of Health. We're very happy with your appointment. One of the wisest decisions made by the President in appointing a person to the helm of at the helm of the Department of Health. There is this brewing controversy about increasing the membership fee in Philhealth. You being the chairman of the Philhealth, ex officio, as chairman of Philhealth, what do you say about this matter?
Siguro, una-una, magandang umaga sa lahat. No? Magpupuwento lang ako muna bago sagutin yung tanong na yan. Kasi nung nakita ko si Bert Lina, naalala ko yung mabigat naming problema nung undersecretary ako. Diriksa tayo ng Typhoon Haiyan. At wala kaming, hindi namin alam kung paano papadala yung mga gamot sa Tacloban. Kasi yung lahat ng mga gamit namin, tinamaan din ng storm surge doon sa mismong regional office sa Tacloban. Sinong sumaklolo sa amin? Si Bert Lina. Pinahiram yung kanyang mga aeroplano ng at nadala ang mga gamot, ang mga bagong supply ng gamot. Kaya tuwa ako nung nakita ko siya kasi walang may alam sa public na. That is not known. So I have to announce that. And that's where we are. Yung kailangan tayo ng solidarity to solve the problems of health in the country. Yung quiet people helping me out. Sa Rotary Club namin sa Makati Central, talagang ako dati ang tumutulong ng bata ako yung nag-organize ng mga medical mission. Pero ngayon, si Senator Joey Lina na ang nagpatakbo nung first 1,000 days na coalition na talagang napakagandang programa. Meron public act yan pero walang nangyari. Pero nung gumalaw yung Rotary Club Makati Central ng libo ngayon, at na-discover ko pa, tandaan nyo to, kayong mga taga-DOH, pag nagrenta ka pala ng space dito or function room, may libreng singer. So, tandaan nyo, hihingin nyo yun, ha? Hihingin nyo yun. Pagka nagrenta tayo, nag-organize tayo dito ng event, make sure. So, punta na tayo sa tanong. Parang iniiwasan yung tanong. Well, basically, ang Universal Healthcare Law nag-implementa or nagsabatas ng successive increases in Philhealth premium. Ang intention ng batas para gumanda ang benefit packages ng Philhealth. So nag-umpisa yan parang 250 pesos lang eh. Hati pa ang empleyado at ang employer. So parang 120 lang sinusweldo. Pero in-increase yan, since 2019 dapat i-increase yan ng 2%, 3%, 4%, at 5% by 2024. Ang kaso, nung panahon ng COVID, sinuspindi yan ng ating presidente, si Duterte. Kasi COVID. Tapos nung pumasok naman si President Marcos last year, sinuspindi niya at kinonfirm naman ng Kongreso. Kasi parang kasi batas siya, kailangan ang Kongreso has to confirm. So na-confirm yan. So it is suspended. Ngayon, alam ko inimplementa na ng Philhealth as of January 1, yung 2024 rate, which is a 5% increase. Medyo malaki siya. Parang lalabas parang 1,300. So,
yung increase, Secretary, or yung kabuuan?
5%. Yung babayad mo ay annually. Parang tumaas, no? 5% increase. So kailangan natin pag-usapan yan. Actually, implemented na siya. Pero kailangan pag-usapan kasi suspended siya. So, I think ang pinakamaganda dito mapag-usapan kung pwede na ba siyang ituloy o kaya pa rin magbigay ng benepisyo ang Philhealth base sa Tama-tama, i-raise ko to sa board meeting ko kasi board meeting ngayong hapon ng Philhealth. So, in-announce kasi yan 2 days, Friday last week. So, hindi ko alam na in-implement na pala yung batas as it is. Pero pag-uusapan namin sa board para malaman ko kung ano ang pwedeng gawin kasi mas maganda siguro suspended pa rin siya. Kung akong tatanungin, suspended pa rin siya. Nung sinuspend siya, wala namang nawala sa mga benepisyo. Nabigay pa rin, nag-increase pa nga eh. Kasi sa Universal Healthcare Law din, nilipat ang pera ng PAGCOR, PCSO, iba pa, saka Syntax, ibinibigay sa sa Philhealth para pambayad sa benepisyo ng mga mahihirap. Naalala niyo yung panahon natin, pinasa natin yung Syntax. Kaya pati yung mga mahihirap ngayon covered. So ngayon, ang Philhealth, ang sistema ngayon dito, miyembro na lahat ng Pilipino based on the UHC Act of 2019. Ang problema na lang is kung anong klaseng member ka. Kung ikaw ay may trabaho, ang tawag sa'yo, direct member. Nagko-contribute ka. So parte ng may premium ka, may annual premium, at yun ang gustong itaas yung indirect member, ang tawag doon, yun yung ating mga walang trabaho at considered poor by the DSWD National Household Targeting System na magkakaroon ng bagong listing na naman. So, mabavalidate yung poor, yun funded through Syntax. And then yung mga other benefits, alam niyo, di ba, may clinic sa PAGCOR, may clinic sa PCSO, nagbibigay ng pera. Ang sabi dun sa USC, ibigay na lahat sa Philhealth yan. At yun po yung ginamit, yung PAGCOR contribution, yun ang ginamit. Kaya yung dialysis sessions na dati 90 plus lang, naging 156. So whole day na, whole year na ang dialysis. Dati, pagdating ng September, ayan na yung mga dialysis patient. Nagpapalimos siyang ka-congressman, kay senator sa faith-based organization. So nabuo na. So actually maganda yung mga implementation ng batas. Ang problema lang kung nagtataasan kasi lahat ng bilihin eh. It's the right time to actually already fill in. And I know Philhealth is healthy with a very good reserve and very good investments. Kasi yung hindi na nagagastos na invest. So ang thinking ko dyan, you ask me, pwede pa rin isuspinde. So, ididebatihan namin to ngayon sa board meeting.
If I may, sometime in 2021, at the height of COVID, meron po kaming editorial sa Manila Bulletin tungkol sa Philhealth. Dahil ako po ang naatasang sumulat nun, nag-research naman po ako ng konti. Pag in-analyze nyo po yung balance sheet ng PhilHealth, isa doon sa main means of analysis is known as sources and uses of funds. Inuturo po yan sa lahat na nag-aaral ng MBA. Pag as of that time, no, hindi lang po ako sigurado, third quarter of 2020 yata, nakita kong published balance sheet of PhilHealth. Napagtanto ko po sa aking analysis, may humble analysis, na kulang ang kapital ng PhilHealth. PhilHealth is undercapitalized. Kumbaga sa kumpanya po, napakaraming gustong gawin, kulang ang kapital. Of course, kung katulad po ng private enterprise, pwedeng umutang, pwedeng mag-raise ng bagong equity. Pero doon sa nakikita ko po naman, lalo na doon sa sinabi nyo ngayon, yung syntax, for example, talagang ang priority doon ay yung, isa sa priority doon yung PhilHealth. Kailangan lang sigurong pag-aralan ng ating mga financial managers in coordination with the DoH. No? Pero sa akin pong nakita, yun ang basic requirement to review the capitalization of PhilHealth in order to fund all of its programs. Dahil bigla pong dumami yung responsibilidad ninyo, pag-aralan po ninyo kung dinagdagan ba o hindi yung kapital. Palagi ko po hindi. Paano namang mangyayari yun na dumoble, trumiple yung coverage, yung capital hindi in-increase? So baka nandun po yung possible solution to rationalize the capitalization of PhilHealth.
Tama yan, medyo tama yan. Pero sa totoo lang, ang PhilHealth, tumataas yung capitalization ng government. So for the indirect members, it has increased from nung panahon natin, 30 or 50 billion lang ang kino-contribute. Umabot na yan to about 80 billion last year. And this year, parang ganun din. Ang hinihingi actually ng PhilHealth was 110, pero binawasan ng Congress, inilipat sa DOH. Wala namang problema yun kasi meron akong medical assistance for indigent patients na direct nagbibigay ng benepisyo sa taong na ospital. Naiinis kasi sila sa PhilHealth kasi inefficient. Ang daming utang sa ospital, ang tagal magbayad, nagsasara yung mga ospital, nagbebenta. So, lalong lumiliit yung ating health system or health services. So, complicated yung health system. Siguro ayokong pag-usapan dito kasi talagang complex siya yung ating health system. But, we have the platform to be able to deliver very good universal healthcare kasi may single payer system tayo. Kailangan ko lang talaga magaling na mga namamahala sa PhilHealth para maayos talaga. And for your information lang, during the Congress hearings last year, napaka-robust ng PhilHealth sapagkat inalaw sila mag-invest. At yung kanilang investment, lumaki po. Gusto nyo malaman kung magkano?
Baka po, excite ang public.
Umabot na ho ng 400 billion yung investments nila. So, yung increase na bibigay natin sa 5%, 17 billion lang ang mako-contribute. Drop in the bucket. So, if you're a financier, I mean, they can still get some of that investment and continue to support and subsidize. At saka hindi naman ho lahat ililibre. Ang PhilHealth, tandaan nyo, will not make everything free. Magkatulong ang national government, GAA, ang hospital funds ng gobyerno. So pag ikaw na poor patient, pumunta ka sa public hospital, ang mangyayari dyan, no balance billing ka namin. Ano ibig sabihin? Yung doktor namin may sweldo sa gobyerno. Yung gamot binili ng GAA. Tapos yung contribution ng PhilHealth, pambili namin ng pan-replace ng gamot. So yun yung nadidinig yung NBB. Pag ikaw mahirap, pumunta ka sa public hospital, no balance billing ka. Kahit ano pa. So ang problema, siyempre, pag pumunta ka sa private hospital, sa hospital doon sa Villaflor Hospital sa Dagupan, siyempre, ano yan private investment yan. So that you have to pay. Yung support value ng PhilHealth, parang nasa 40% lang yata, 30 to 40%, depending on the type of procedure na ginawa. So maglalabas ka talaga ng out of pocket pag pumunta ka sa private. So yun yung ating kailangang pag-usapan sa health systems sa health economics. dapat ang gusto kong mangyari, lumiit yung out-of-pocket ng bawat citizen. Kagaya ng nangyayari sa ibang bansa like the National Health Service ng UK, ng Germany, ng Scandinavia. Pag ikaw citizen, ang tax nila ang tataas, ha? 35% ng kinita nila binibigay sa gobyerno. Pero pagpasok mo sa ospital, lahat sagot ng national government. So we're trying to get there from the American system na may public at may private. Pero hindi siya mangyayari overnight. Mangyayari siya over time. Papalakihin natin. And that includes itong pag-increase ng premium. Tama kayo. That includes, if you want to give more benefits, part of it really is to increase the capitalization. So, napakaliit ng capitalization natin. Sa ibang bansa, ang National Health Insurance nila, pinepeg sa sweldo ng tao. So, kung mas malaki sweldo mo, mas malaki ang contribution mo. Sa atin, fixed. Basta kahit executive ka at singer ka dito sa Manila Hotel, yung contribution niya pareho nung janitor dito sa Philhealth. But it's the same contribution. Yun yung kaya, do you want to go there? Gusto niyo ba tataas lang lahat? Or gusto niyo itaas natin yung sa mas mayayaman? There are many ways of increasing capitalization. So, yan ang mga usapin dyan. Pero malalim na usapin yan, di ba? Kasi it requires change in the law. Diba? At saka it requires change in principle in the way we manage the corporation. Gagawin natin yan. I-reform natin ang Philhealth, pagandahin natin ang Philhealth, pagandahin natin ang serbisyo sa mga Pilipino.
Mayroon akong naririnig at patuloy na naririnig, Secretary Ted, na maraming private hospitals pa rin ang singilin ang hindi nababayaran ng kanilang serbisyo. Ang figure na narinig ko is about 30 to 50 billion, 28 billion pesos in arrears na hindi nababayaran ng PhilHealth. Ay ano po ang, unang-una, totoo ba yan? Pangalawa, anong gagawin? Kung totoo yan, anong gagawin ng PhilHealth?
Sige, dapat pala, imbitahan mo. Kasi ano nga tanong?
Yung arrears.
Yung utang. Okay. Ang dapat kasi, ang ospital, pag may nagpagamot sa kanyang PhilHealth member, within 60 days, ma-file niya yan. And usually may computer, i-upload niya. Alam niyo naman, ang nangyari, na-hack yung computer ng PhilHealth. Hirap na hirap sila, nag-iiyakan sila, hindi sila maka-upload. Tapos dumadami, dahil universal healthcare na tayo, sabay-sabay yung nag-upload. Nasisinok yung aming operating system. Nagre-reklamo sila kasi nag-upload ka. May mga hospital na nag-upload 2 a.m. Para pumasok. So, basically, kailangan i-improve at gawing efficient yung filing. So, ang nangyayari dyan, nare-return to hospital kasi double claim daw. Kasi nagpapal siya, nahuminto. Tapos pinahal uli ng clerk, kakasuhan pa siya ngayon. Double claiming, grabe gano'n. Kaya nagkakaproblema kami dyan. So that has to be improved. And the other thing is, pagdating na ngayon, pag na-file mo na within 60 days, PhilHealth has another 60 days to pay. Hindi sinusunod po yun. Magbabayad sila 3 months later. Ikaw, ilang months later ka nababayaran? 6 months later?
1 year.
1 year later. Kaya nga nung Congress, nung hearing, tinanong ito dun sa PhilHealth president at sinagot niya, I promise to pay all the arrears, the 28 billion in 90 days. So, kailan ba yun? Kailan pa nangyari yun? September yata yun. August. So, I'd like to know, siguro I'd like to know in a report kung nabayaran nga yung arrears ng mga hospital. Nung nagtatanong naman ako ng asosasyon, yung Private Hospital Association na convention dito nag-convention, hindi pa rin daw sila nababayaran. So, hindi pa lang kung sino nagsasabi ng tao. Sabi nung PhilHealth, nagbayad na sila. Sabi ng mga hospital, hindi pa sila nababayaran. So, basically, yan ang storya natin. Ang private hospital, very important. Ang private hospital, yan ang pumupuno ng gap ng ating health system. Para maintindihan ng mga nakikinig, the bed capacity of the Philippines is at 0.5 yata per 1,000. The ideal ng WHO is 1.5. We need to triple our hospital beds para hindi ka pipila bago ka ma-admit. Ang problema, we have about 1,800 hospitals. 54% are private. o beds, yung total beds. 1,800 hospitals, pero 80% of the Filipinos go to the public hospitals. So hindi na kayo magtataka. Pag pumunta kayo sa PGH, dun sa ER na for 60 beds, 200 patients ang nakahiga doon. At ang masaklap doon, Manila Hospital yan, sa Maynila, nung head ako niyan, every week, we see 5,000 patients. 1,000 coming from Cavite. Another 800 coming from Laguna. Pagdating ng taga Maynila, lumipat na ho kayo kasi puno na kami. So basically, dinadagsa pa tayo ng outside NCR kasi 4A yun ibang region. So we really need to increase the capacity of the hospitals. Ang tutulong sa atin dito, yung mga private hospital. Yung Villaflor Hospital, nung binigyan ng lisensya ng DoH yan, sabi ng DoH, pwede ka mag-operate pero 10% of your beds should be for the public use. Well, charity ang tawag doon. Gusto ko sana ipaliwanag din, wala nang charity ngayon. Alam niyo ba? Nagulat kayo. Wala na hong charity kasi ang tawag na natin sa pasyente ay either private patient, nagbabayad ng sariling pocket, or public patient, ang nagbabayad ay Philhealth or national government. So we require hospitals, private hospitals, to allocate 10% of their beds. Kung 200 beds, ilang beds pa ang Villaflor? 190, 200, let's say 200, 20 beds will be for private. So that means pag may pumasok na mahirap dun sa ER, pwede niyan tanggapin at singilin ang PhilHealth at singilin ang minsan may tumutulong yung aming MAIP, which is the Medical Assistance for Indigent Patients. Kung malamang may kontrata ka sa regional, so nababayaran ka ng MAIP. So hindi pa in-implement strictly yan. Plano ko implement strictly yan na lahat ng private hospital talagang gagamitin ko yung 10%. Actually, yung occupancy rate ng mga private hospital nasa 70 to 75% lang. Laging may bakante yan. Unlike yung sa public hospital, 200% ang occupancy yan. Laging puno yan. So, even without increasing capacity, basta tumulong lang yung private sector sa akin, babayaran ko naman hindi na siya charity babayaran naman ng PhilHealth at ng ano. So may konting kita, kaya sa walang kita, vacant, may income na konti. So, I'll need that. Hindi yung pilitan. Parang mas maganda, hey, ganito yung ano nyo di ba? Tumulong na kayo sa national government para sa ating mga kababayan.
Secretary, isang malaking problema ng bansa, yung crisis malnutrition. At ito'y hindi alam ng marami. Marami pang hindi nakakaalam na malaking problema natin sa malnutrition. Yung hindi sapat at wastong pagkain. Kaya mahina ang katawan, mahina ang utak, at hindi lumalaki. At ito'y nag-uugat, itong problemang ito ng mahina ang utak, hindi lumalaki, at masasaktin. Nag-uugat yan, nagsisimula pa lamang doon sa unang 1,000 araw ng buhay ng tao mula sa pagbubuntis, from conception, from 0 to the second birthday. Meron na tayong batas niya, Republic Act 1148, na talagang ang specific focus of that law is the first 1,000 days of life. At ang mga non-governmental organizations nagbuo na ng koalisyon, alam mo naman ito, at talagang sasama sa pakikibaka laban sa malnutrition, particularly in the first 1,000 days. At ito ay sa pamamagitan ng pakikipag-ugnay at pakikipagtulungan sa gobyerno. Itong koalisyon na ito binubuo ng Kiwanis, Lions, Rotary, JCs, Knights of Rizal, Knights of Columbus, the pre-accepted Masons, Fraternal Order of Eagles, Knights of Rizal, Physicians for Peace, Save Our Children, World Vision, Breastfeeding Association, ang dami na po. All Rotary Clubs all over the country, talagang sasama na ito. Sa pagtutulungan ng gobyerno at ng NGOs, at talaga maigting ang pagkilos, sama-sama, palagay po ba ninyo ay mawawakasan natin or mapapawi natin na malaki ang malnutrition in the first 1,000 days in the next decade or before 2034?
Actually, nung nag-meeting kami ng cabinet sa NEDA, sa Malacanang, nilagay ng NEDA in 10 years. Sabi ko, hindi ko gusto yan. Gusto ko next year. Wala nang stunting. Ganito kasi ang problema para maintindihan nyo. Ang rate of stunting natin, according to our statistics, the National Nutrition Council, is 27%. Alam mo ibig sabihin yun? 3 out of 10 Filipino children are stunted. Ulitin ko 3 out of 10 children are stunted. Sabi ni Lina, hindi siya naniniwala na tayo yung lowest IQ. Ako, kung 3 out of 10 children are stunted, that means 3 out of 10 children's brain development stopped by the time they were 2 years old. Hindi na lumaki yung brain nila. So yan yung ating human capital, paglaki na. Kaya ako, naniniwala ako dun sa data na ginawa, nasa in the ASEAN region, we are one of the lowest, mataas lang yata tayo sa Cambodia at Laos.
Kulelat nga eh.
Kulelat ba?
Ayaw ko maniwala, Secretary. Pero
Okay.
tama yung statistics na yun.
And hindi lang yan. Ang proof niyan, nung umikot ako sa Mindanao, siyempre, umiikot ako sa mga regional office, pumunta ako dun sa isang regional office, pagtingin ko sa paligid ko, lahat ng empleyado below 5 feet. Sabi ko, ang cute nyo naman dito, below 5 feet. Tapos nag-joke ako, siguro hindi kayo nakakain ng bata kayo. Kasi you know, one of the health indices of a country, dalawa lang yung 2 most important health indices of a country. 1, life expectancy at birth. 2, average height of the people. Yung mga Hapon, in the 1940s, pandak sila sa atin kasi mayaman tayo. We're one of the richest countries here. Sagana ang pagkain. Ngayon, 6-footer na yung mga Hapon. Magaganda na yung ngipin. Dati, bow-legged sila, basong kilso yung ngipin. Sakang, kilso yung ngipin. Ngayon, 6-footer na. Tapos magaganda na yung ngipin, magaganda na yung oral health. So they have improved together with their economic development. The Philippines deteriorated. We went down. Our nutritional rate, our life expectancy went up, but our nutrition didn't improve. Bakit? Yung feeding program natin mali. We have feeding program. Di naman huminto yung pagtutulong sa mga malnourished. Kahit nung panahon natin doon, we were feeding preschool, DSWD, merong feeding program yan sa mahihirap. Pagdating sa school, sa DepEd, may feeding program yan. Kaso malungkot din yung na-discover ko nun nung USEC ako nun. Pag nasama ka pala dun sa feeding program, pag uwi mo sa bahay, hindi ka kasali sa pagkain. Kasi kumain ka na ng 3 beses, merienda, tanghalian, merienda. Hindi, maiyak ka talaga sa hirap. Yung isang bata na napasok doon, mapapasok ka kasi doon pag mildly or moderately malnourished ka. Kasi targeted ka. Pero ang mali doon, finifeed natin sila at age 3, yung daycare, age 3 or 4, huli na yon. If you feed natin sila sa school age, huli na yon, stunted na yung brain nila. So, kahit anong ganda ng DepEd mo or education, kahit hire mo yung the best teachers, if your brain development stop after the first 1,000 days because of lack of nutrition. And may nagsalita sa atin nun, di ba? There was this neurologist who explained this phenomenon and he had evidence na talagang the brain development stops. So kawawa yung human capital natin. We will become a high middle income country, but our human capital, 3 out of 10 have low IQ. Hindi maganda yon. We need innovation. We need a human capital that will drive the economy forward. So we need to save these children through the first 1,000 days. At yung first 1,000 days coalition, natutuwa ako dyan. Pinasa yung batas. Like any other law, alang nangyayari, walang nag-iimplementa. Until itong mga private sector, NGO, nagsama-sama. Actually, hindi pa ako secretary noon. May, naalala ko, nag-lunch, nakinig ako sa lunch. Sabi ko, Senator Joey, i-commit ko yung NGO ko dyan, Physicians for Peace. Actually, naipasok ko. Ang problema noong June, in-appoint na akong secretary, so hindi na ako makasali. Pero ngayon, Nag-attend pa rin ako nung Sabado. Nag-ano sila, first launch of the manual of operations, kung paano na nila patatakbuhin yung kanilang sistema. At napakaganda because parang standardized yung pag-apply, how they will find the buntis, what to do for the child. At kinumit ko naman, nung naging akong secretary, sabi ko, Senator Joey, lahat ng buntis dyan sa first 1,000 days, ibigay mo sa akin at meron kaming programa sa maternal and child care. Binibigay namin yung folic acid, yung kanilang anti-tetanus, at yung padadagdagan ko pa sa Philhealth, yung kanilang prenatal package. Kasi ang prenatal parang 3 visit lang. Dapat gawin nila, 9 months, monthly dapat, di ba? Para pataasin natin. Pagkatapos yung bata, pag pinanganak, para hindi siya mamatay, bigay natin yung vaccine preventable diseases. Lahat ng bakuna, siyam yan. Kailangan maibigay dun sa bata. Tapos, breastfeeding, implement ng mga programang existing na to. Katulong namin, mandatory breastfeeding for the first 6 months para talagang all the nutrition the child will get. And then, yun na, tuloy-tuloy na educate natin yung mga mothers na the best way to feed them is good nutrition. Hindi fast food. Talagang yung kami ng mga nanay natin, home-cooked, fresh food, di ba? From the vegetable to the luluto na, that's more nutritious kasi nakukuha mo yung vitamins and nutrients. Ibalik natin doon sa old tradition of home-cooked meals and nutritious meals. May kinausap ko na yung mga, siguro pwede ko na rin i-announce to. Umuko siya sa akin si Margarita Porres kumakain ako, nag-host siya, sabi niya, yes, I will help the first 1,000 days. She will gather all the lady chefs and they will help prepare simple meals that are nutritious.
Okay, I will get in touch with Madam Margarita Flores and quote you. That's a very good initiative.
Natin gawin sa Manila.
Dito sa Manila, dito sa Manila Hotel. Mr. Secretary, where you see how many cameras are in front of you, okay, and how many writers and bloggers are here. Can you now appeal on behalf of the non-governmental organizations or the entire civil society? Can you make an ardent appeal for the media to be a partner in this fight against malnutrition during the first 1,000 days of life, knowing that awareness is the key. If you don't know that there is a problem, you'll not do anything to solve it because you're not aware. So number one is awareness. In the manual of operations, the first move really is to make everybody aware of the importance of proper nutrition, particularly in the first 1,000 days of life. That is from conception up to the second birthday. So number one is awareness, and somehow it is likened to be an elephant in the room. Hindi gaano pinag-uusapan. When this is a crisis that is facing us every day, a child is born. 180.
Manual of operations.
This is the manual of operations that we...
Colored yung maganda pero print out lang.
Ito, print out lang. But we give this still...
Bigyan natin sa media. Para
this is really... all systems go already. That if you are... you take care of your own family, that's first.
Yes.
You know? Because even your children may not know how to address the nutrition issue. Baka junk food ang binibigay during, semi-solid food, baka junk food ang binibigay. And then, kung ikaw ay miyembro ng NGO, you take care of your NGO, especially your leader. Sa NGO mismo, sa inyong organisasyon, mag-seminar na kayo once a year. At sa kumpanya naman, at least once a year, nagse-seminar yan. A mass may seminar, no? And then yung NGO to adapt, or a business to adapt a barangay. Yun ang flow natin, to adapt a barangay. At nakalagay dito what to do before yung first activity, General Assembly, awareness. Number 2, buntis na, registration, ano yung gagawin? First 3 months, second 3 months, third 3 months, after birth, up to the second birthday. Nakalagay na rito kung anong gagawin. So, Mr. Secretary, I think this is a good time to ask the help of our media friends to make this top of mind whenever there's an issue about health, incorporate awareness on nutrition in the first 1,000 days.
Pero kung kwento ko yung experience ko when I was a visiting professor in Malaysia. Visiting professor ako 3 taon sa Malaysia. Doon, hahawak ako ng either tabloid magazine or the full tabloid newspaper or the full. Laging yung headline, ang sub-headline, health. Pagpunta ko sa page 2, health lahat ng article dun sa page 2. Anong kini-create nito? It creates a citizenry that is health conscious. Binabasa nila. Kasi ayaw nila yung politics eh. Gusto nila yung health. so, atong Singapore, Malaysia, ganun yung type. Sa atin, subukan mo humanap ng health topic sa journalism. Wala. Politics, tapos entertainment, tapos sports. May health once a week. Siguro isang doktor.
Sa politiko araw-araw meron.
Politiko araw-araw. So anyway, I think ang natumbok ni Senator Lina is one big problem of our country. It's called health literacy. We are mostly health illiterate. And that is why nutrition fails. That is why vaccination, pati nanay, hindi nagpapabakuna ng mga anak niya. What we need, and we need your help, the media, kaya ngayon ako, sabi ko na dun sa media, once a week na ako dati, ang daming trabaho eh. But I realized, as Secretary of Health pala, I'm actually the communicator for the projects of the President in terms of health. And this President, President Marcos, is really very attuned to health. Yan ang sasabihin ko sa inyo, in my discussions with him, ayaw niya ng mga trophy. Sabi niya, I want to improve health. And I'm honored when that's told to me. Pero natatakot din ako kasi it's a tall order. Changing nutrition from 3 out of 10 children to 0 stunting. Yun ang goal natin. But we need to educate mothers. We need to educate everyone. You know, ang mga nanay natin, double income family na tayo ngayon eh. Ang mga nanay nagtatrabaho na hindi kagaya nung lumaki ako, pag uwi ko sa bahay, palit ka ng shirt, madumi yan, maligo ka muna. O gutom ka ba, iluluto kita ng gusto mo. From scratch. Ano ngayon ang habit natin? Tatawag yung nanay nagtatrabaho sa opisina. Oh, tawag na lang kayo, padala na lang kayo ng food, magpa-order na lang kayo sa near. Ano ma-orderin ng mga bata? Yung gusto nilang fast food, yung gusto nilang fried, patty, walang nutrition. So, very important na magkaroon tayo ng health literacy. Nanonood ako ng mga competition ng chef, yung mga bata, junior chef. Mga bata, ang gagaling magluto, alam nila yung nutrition. And these are in first world countries. So, even the kids, they know how to cook their own food. Hindi tatawag ng fast food. Diba? So, baka we should move towards that. More health literacy. And I think, andito mga journalists, mainstream media, I really need your help. The first 1,000 Days Coalition needs your help. We can't do it with all this, pero if we just educate everybody and make them aware, number 1, pabakunahan ng mga bata. Number 2, nutrition. Eat well, di ba? Pag magawa na lang yung, meron akong 8 priority goals eh. Pwede ba ilatag yun?
Okay.
Ilalatag ko yung 8 priority goals ko na naisip ko na, habang secretary ako, ito dapat mangyari. Yung immunization program, dapat ma-achieve natin yung 95% immunization ng lahat ng bata below 6 years old. Bakit? Walang outbreak, walang measles outbreak, Alam niyo ba ang current rate natin? 71%. Sa BARM, 45%. Yun, dun yun, sa BARM, meron kaming measles outbreak. So, nakikita niyo, kung wala tayong all these kids will not die from vaccine preventable diseases. Binibili ng pamahalaan yun. Libre yun. Pupunta ka lang sa health center, babakunahan ka lang. Sabi ng mga taga-DoH, hindi ho mangyayari yan, 95. Sabi ko, hindi, nangyari yan. Nung nasa DoH ako, si Secretary Claver, nagawa yan. Yung national vaccination, na-reach yung 95. So I want to reach that also. Second, nutrition. Itong rate of stunting is so bad. 3 out of 10 Filipino children. Sabi ng mga economists sa kabinete, we will be declared high middle income country by next year, 2025. Ano ibig sabihin ng mayaman na tayo? Pero mayaman tayo, pero bansot yung mga Pilipino, pagkatapos stunted yung utak niya, mababa IQ. Useless maging mayaman. I'd rather be healthy, if you ask me. Health is wealth. So I'd rather make sure that all the poor children are given nutritious food and good. Number 3, maternal mortality. Ano ba yung maternal mortality? Yung mga buntis na mamatay. Noong panahon natin, target natin to MDG goals, di ba? 154 per 100,000 buntis na mamatay nun. Ang taas nun, parang Africa rate yun. Nagtrabaho kami, merong mga ultrasound, may mga, ang nababa namin yan to 125 nung umalis ako as undersecretary, 125 per 100,000. Nung tinignan ko yung statistics nung time ni Duterte, 111. Sabi ko, bababa na below 100. After COVID, 144 over 100,000 bumalik. And nung sinuri ko kung ano yung problema, teenage pregnancy. Jolina, dapat pag may batang na buntis, 12 years old, someone has to go to jail. That's rape. A child gets pregnant. So, pag tinanong mo naman yung bata, sino ba yung nakabuntis dyan? Yung kalaro niyan, 15 years old.
Wisconsin law.
That we have a problem, di ba? And then these kids, tinatago yan, hindi nag-prenatal. So dadating na lang yan, malaki na tiyan, nagle-labor na makikita dun sa ER ng PGS. Buntis ito sa OB gaya nito, hindi ito sa Department of Pediatrics. Kasi Department of Pediatrics hanggang 18 eh. Buntis pala, malaki yung tiyan. Tapos manganganak, undernourished yung bata, hindi na monitor yung, walang monitoring of the weight gain. We need to fix that, di ba? Number 4, TB, tuberculosis. Pero mo magiging tayong rich country pero tayo ang supplier ng TB sa mundo. Hindi TV, television na, pulmonary tuberculosis. Di ba? Pag pupunta ka nga sa ibang bansa, kailangan magpa-x-ray ka pa eh. Pero parang nakaka-insulto yan. Pag Pilipino ka, kailangan i-submit mo yung x-ray mo para i-prove mo na wala kang TB. Why? Because we're supplying the rest of the world with multiple drug-resistant TB. So, ang problema naman dyan, yung stock out. Bumibili ng sapat na gamot, pero wala doon sa mga TB center. Inikot ko eh. Umikot ako nung first 6 months ko. Sabi ko, bakit ganun? Ba't nauubusan ng TB meds ito? Eh pag pumunta ako sa sari-sari store, sa pinakamalayong isla, may beer, may sigarilyo, may shoktong. Di ba? Pero yung TB na dapat makuha ng pasyente, wala doon sa TB center. Ang sasabihin ng TB people, bumalik ko kayo next week, baka dumating yung supply namin. O anong mangyayari nung pagbalik next week, wala na naman. Hindi kakalat yung TB, hindi na natitreat. Tapos nag-face mask. Nung time ni Duterte, nag-face mask tayo. Okay, sabi ko, hindi kakalat TB. Bakit kumalat? Ba't nag-triple after COVID? Paano? Quarantine, magkakasama sa bahay. 3 families in 1 household, tapos tinatanggal lahat ng mask. Isa lang may TB doon, hawa lahat. Kasi wala sa trabaho. so yung TB, kailangan ayusin natin. A-attend nga ako ng meeting ng Stop TB sa Brazil itong February. At nakakahiya na tayo ay number 4 sa mga country sa mundo na may pinakamataas ng TB. And we need to fix this. We need to do active case finding. We need to treat people that have latent TB, and we have to complete therapy para sa lahat. And kaduktong nitong TB, yung HIV. Yung HIV, hindi pa ganun kasama. Kasi 1% pa lang ng population ang people living with HIV. Mga nasa 58,000 lang. Ang masama, itong current rate, last year, 20 new cases a day. This year, 50 new cases a day. More than double. So anong problema? Ang bata, 15 years old, HIV positive. Ang masaklap, 18 years old, patay siya ng AIDS. Usap yung expert natin sa HIV, si Edsel Salvania. Sabi niya, wala dapat namamatay sa HIV. Tignan mo si Magic Johnson. Basta umiinom ng ARV, buhay yan. They will die of other causes and live a normal life. Sa atin, ba't namatay within 3 years? Yung 15 years old, pag nag-positive yon, nawawala siya. Alam niyo kung bakit nawawala?
kailangan niya ng parental consent para maumpisahan yung ARV. Eh siguro hindi niya matapat sa tatay niya, ba't ka nagka-HIV? Eh alam naman natin what is the main cause, men having sex with men ang main cause. So siguro hindi niya matapat sa, baka agulpin siya ng tatay niya pag nalaman niya. So nawawala yan. Babalik na lang yan, 18 years old, full-blown AIDS na. We need to fix that. We need to pass laws wherein the doctor or a guardian can allow. Kasi hindi mo nabibili yung ARV, sinusupply ng gobyerno yan. The government, you can, unlike TB, yung TB kahit stock out dun sa TB dots, kung may pera ka, pumunta ka sa butika, yung reseta mo mabibili mo. So pwede pa kung may pera ka. Pero sa ARV, kailangan marehistro ka, babayaran ng Philhealth yan, at nakamonitor ka sa amin. Kaya alam namin yung numbers. So yun lang yun. Yun lang yung bilang namin. Eh paano pa yung ibang hinawa nitong 15-year-old na to na hindi nagpa-ARV, na hindi nagpapatest. So meron pa yan. So, big problem yan. Maliit na problem siya, pero pag hindi natin na-control yan soon, it will blow up in our faces. Number 5, road safety. Ito, advocacy ko na. This is my personal advocacy because I did research for a decade of road safety. And I discovered that in the Philippines, a young male riding a two-wheeler motorcycle is the 70% of our road crash deaths. Si young male is an ordinary laborer ng minimum wage. Hirap na hirap siya sumakay sa bus at sa LRT. Nung nakaipon siya, umutang siya, nakabili siya ng motorsiklo. Ang problema, pag sumweldo siya sa 15 o 30, aayain niya ng kabarkada niya. Mag-iinuman yan. Akala niya, kahit lasing siya, mapapaandar niya yung 2 gulong. Buti pa si Sir Joey Lina, yung 4 gulong napapaandar niya kahit may tama. Pero yung bata na, they crash. And they crash of head injury. Hindi ganun karami ang neurosurgeon natin, hindi ganun karami ang citizens. So they die in the provinces, they die. Ang taas ng death rate natin. Ano ibig sabihin nun? Social impact, may iniwan niyang asawa, 2 o 3 anak. The economic cost to government is very high. We need to fix. We need to improve public transport para hindi na magmotorsiklo. Or we need to build them motorcycle lanes that are safe na hindi pwedeng pasukin ng bus o sasakyan. So we need to save their lives. Or else, dadami na naman yung mahihirap natin. Number 6, non-communicable disease. Hypertension and diabetes. Pinili ko yung 2, pinaka-common. Hypertension. Many of our Filipinos die of heart attacks and strokes because of hypertension. So we need to control hypertension. Madami dyan, hindi nila alam hypertensive sila. So mahihirap. Pag nagpa-check up na lang dun sa lab for all namin or mission, bigla malalaman niya hypertensive na siya. Makakakuha siya libreng gamot dun, pero after a week, wala na siyang pambili ng anti-hypertensive. When in fact, we can control hypertension if we give it free or Philhealth will pay for it. Diba? Ako, mga 5,000 yata yung nagagastos ko, mas hypertensive ako. So, yung pangalawa, diabetes. Diabetes, ang storya ng diabetes, connected dun sa dialysis machine. Lahat ng mga congressman, hinihingan ako ng more dialysis. 70% of our end-stage renal disease are diabetic nephropathy. Anong ibig sabihin nun? Ibig sabihin nun, nagka-diabetes sila, hindi na control, nagkaroon ng end organ failure. Kasi yun ang epekto ng diabetes, papatayin yung mga organs mo isa-isa. And the kidneys die. So anong solusyon dyan? Hindi dialysis machine ang solusyon dyan or more dialysis sessions. Ang solusyon dyan, prevent people from getting diabetes. And if they get diabetes, make sure they get the anti-diabetic medicine so that the kidneys do not fail. Pag ginawa natin yung kabila, ang gastos nun. We will have people walking around, hindi lang stunted, nakakabit pa sa makina 3 times a week. What type of human capital do you have? Diba? So, that's my number 6 na ako. My number 7 is cancer. Cancer, isa pang mabigat na problema to. Ganun din, gumagastos tayo ng 500 million in DoH funds, 500 million na 450 million for chemotherapeutic agents. Meron pang accusation ng corruption kasi parang may nag-profile na corner ng isang company. Pero there's something wrong. we're detecting stage 1 cancer. 1% of our cancer patients are stage 1. The other countries, 30%. So what are we doing wrong? Patients are coming to the hospitals in stage 3, stage 4. So anong sasabihin ng doktor? Ito, reseta mo, mag-chemotherapy ka. Ang hindi alam ng mga politiko, yung stage 3, stage 4, 6 months, 1 year, patay din yan kahit anong chemotherapeutic agent na ibigay ko. Pero, yung stage 1 breast cancer, let's say, na operahan ni Villaflor, ni Juby, cured yun. Baka nga hindi na kailangan ng chemotherapy or radiation yun eh. Cured yun. So we need to pick up our cancer patients earlier. Yan ang public health program sa cancer. We need to have mammograms in every public hospital. Ito kasing Filipino College of Surgeons, palpak yung ginawa nila nun eh. Nung program namin nun, ano daw, self-breast palpation. Self-breast examination. Who the hell, which country does that? The key to detecting early is a mammogram or an ultrasound, di ba? Yan, cancer surgeon yan, si Dr. Topitas. Kaya tumataho siya. Di ba? Yun ang problema natin. Why? Sa PGH, ang PGH nga, mas masaklap eh. Madidetect natin stage 2. Sa tagal ma-schedule, 6 months later, stage 3 na siya. So anong solusyon? 80% of our cancers in the Philippines are bulk-forming tumors. Ano ibig sabihin nun? Bumubukol siya. Ano ibig sabihin nun? Surgically correctable siya. So dapat ang tinatayo natin, maraming surgical centers to treat this cancer. But we may need to detect them early. Ang mammography sa private, 5,000 to 8,000 pesos. Who can afford that? Sweldo na ng isang buwan yun nung, diba? Kailangan, Philhealth should pay for that also. And at least the initial, diba? The mammogram, and we should make it available in all government hospitals. Umiikot ako, tinatanong kung may mammogram kayo. Sasagot sa akin ng direktor, yes sir. Pero sira po eh, isang taon na akong sira. So, ganun na naman tayo sa problema. So, we need to fix the way we treat cancer. Last, number 8. Digital health, digitalization. I think the way we can fix the health system is to bank on digitalization. We need to digitize our records. We need to digitize. May x-ray na nga ngayon. X-ray with AI. Hindi ko na kailangan pumunta sa pabasa yung x-ray. I can start therapy and treatment with TB. Meron ding colposcopy with the AI, with artificial intelligence. We just need to use the current technology. Pati yung cellphone. Ihaharap ko lang sa mukha ni Senator Lina, makukuha ko yung BP, respiratory rate, pulse oximetry. Talaga, meron siya, approved by the FDA. We just need to get that here. We just need to digitize. Records. Pupunta ka sa isang ospital. Sasabihin nila, ay, record namin to. Pupunta ka sa isang kabilang ospital. Uulitin niya lahat ng test mo. Nagmahal na naman ang treatment natin. Dapat portable yun. Paglipat ng pasyente, lahat ng x-ray, ultrasound, blood test na ginawa niya, mabasa ng receiving hospital. So it's very simple. Digitize so that people will have access. And then even primary care, dapat digital para telemedicine, mental health. Ang dali ng mental health, hindi mo kailangan pumunta sa clinic ng psychiatrist. Mga psychiatrist ngayon, telemedicine na lang. Kasi I can prescribe. Interview lang naman yun di ba? Magkukwentuhan lang ganyan. Pwede niyong gawin yun online. So, these are the things I want to reform. Yung mga remote areas na walang doktor, I can connect them with the doctor in the regional hospital through telemedicine. Ang daming solutions sa telemedicine. And the solutions are here. Meron na tayong korporasyon na nagbebenta ng sariling satellite. Tatayo mo lang dyan. Connected ka na sa internet. Di kailangan may cell site. Nung USEC ako, hindi namin magawa. Gusto kong gawin to. Pero, di ba last mile? Ang ginamit natin yung white space. Pero, di ba last mile? Kasi doon sa pinakagida or remote areas, yun ang walang healthcare. Yun ang kailangan ko i-connect by telemedicine. So, madaming ideya, madaming posibilidad. Pero, kailangan ko tulong ng lahat. I mean, maybe if these writers will write about it, maybe some digital guru will come and propose something to me nice, or maybe someone will get interested in cancer or hypertension or diabetes, and the health literacy improves. Mababa ang health literacy natin. Tandaan niyo, pag nag-clinic kayo, di ba, ang tagal niyo nagpapaliwanag sa pasyente. Sa ibang bansa, when I work, sila ang nagtatanong sa doktor. Meron na sila, download na nila yung sakit nila. Nabasa na nila. No? Di ba? So, we need to increase health literacy and we need the help of media to do this. Ma-increase ko lang yung health literacy, successful na ako as a health secretary.
Let's give the good secretary a big round of applause. Truly a very engaging presentation, and you have all our support,
Thank you very much.
Mr. Secretary, especially Manila Bulletin is here. But together with
Trabaho yan.
together with all the broadsheet, no, and the television station. Maybe we should talk with all the owners of the various TV networks, and we'll have one session with you, with all their executives, so that they too can internalize, embrace this health literacy.
Imagine, you just gave me an idea. Imagine if every TV show has a health reminder.
Every time.
Every day, every show, yung mga sikat na telenovela or whatever, kung may health reminder ka lang doon for free, di naman mahal yun siguro yung
Crawler.
Yung crawler, di ba? Kasi ako pag kumakain, yun ang pinabasa ko.
Maybe we can have a special Kapihan with, say, DoH, DILG, DSWD, kasi interrelated sila, and all the executives of the media, para all segments of the organization, from the owners to the executives to the media reporters, magkaroon talaga tayo ng movement in the media itself. And let Kapihan sa Manila Hotel, together with Secretary Coloma, we can organize a session here, maybe a lunch.
You know, in communication kasi, I noticed, kami mga doktor, we can talk technical. But what I need are people, writers, or people who will laymanize it, so that the ordinary one-in-one industry understands the complicated things I talk about when I talk about bulk-forming tumors and cancer.
Social media.
Ang hirap ipaliwanag yun, but if a writer will be able to explain that in layman's terms na mabasa niya, uy, baka magpamammogram yung isang 35-year-old, ma-detect yung cancer niya early at stage 1. Makapagpatreat siya kaagad.
So, talagang bagong malusog na Pilipino sa bagong Pilipinas.
Yun, bagong Pilipinas, bawat buhay mahalaga.
Mahalaga.
Mantra.
Yes.
Everybody must understand, ang bansa, ang pinaka-importante dyan, human capital. I now am very lucky as the health secretary that has the highest budget ever. 350 billion. Third, rightfully, education, DPWH, and then health. I wish I can overtake DPWH kasi pwede naman PPP yung ano eh. Pwede naman public-private partnership yung mga tulay, airport, which is, so that means liitan mo na budget yan, let the private sector build it, and give the money to me. I will take care of all the Filipinos' healthcare needs.
Mr. Secretary, being a former legislator, I will make health, if I am in that position, I'll make health number 1 and education number 2.
Even better.
I think, why?
Pag mali yung health, hindi ko matutunan.
Kung, in the very concrete example of the nutrition problem, you already emphasized that during the first 1,000 days, the human brain is already formed. And if the child, if the infant is severely malnourished in that period of time, mahina na dito. So kahit na anong reform sa educational system, if the very pupil or student entering the school system has already low cognitive ability or low IQ, wala ring mangyari. So I would prefer that health be topmost. We have to amend the Constitution. Because in the Constitution it said, education should have the highest priority in terms
Pala, dapat education about health.
Ayun, that's correct. Health literacy. Education about health.
Yeah.
Maybe, I met with Secretary Sara. Pupunta ako doon. And I'm thinking itong problema natin sa teenage pregnancy, HIV, because we're teaching reproductive health late. Parang dun sa law, kailangan 13.
buntis na siya ng 12, ba't ituturuan mo ng reproductive health at 13? So we need to have age-appropriate reproductive health lessons at kinder, at grade 4. Yung 12, tuturo mo at 13. Yun ang sabi teach reproductive health at 13.
Okay, we will ask members of the media to shoot their question, but as a last point, Mr. Secretary, and before the media shoots question, we will also ask Dr. Joby Villaflor, ask him about some concerns about your protege will have his...
Mr. Senator, pasalitain muna natin, may I go out lang.
sige. Okay. All right, Dr. Joby, can you take physiological break? Okay. So, Dr. Joby, regale us with your latest concerns regarding surgery.
Actually, sir, maraming salamat po for giving us this opportunity to join you. I believe we are here in support with, of course, through media and of course through your Kapihan, our support to our Secretary of Health. Because we feel that the PCS, the Philippine College of Surgeons po, would want to help the Secretary as regards to access in surgical care. Kasi po, if you see the 8-point agenda of our dear Secretary, the Philippine College of Surgeons can be involved in cancer care. Binanggit po niya na majority of cancer are mga bulk-forming tumors. So if you think about it, it's surgery po ang unang intervention. But of course, prevention pa rin is our goal. So we are here through the Philippine College of Surgeons. We have formed the Cancer Commission that will probably help educate the community as regards to cancer. Second, yung trauma. Trauma, binanggit din po sa agenda po niya, is we really want to help as regards to how to prevent itong mga trauma. Kasi nga po, if we can prevent this, then yung social impact po niya would be a factor. That's why the Trauma Commission was formed. And ang objective po niya is hindi lang po sa disaster preparedness, but also sa trauma, na mga motorcycle injuries. So we want to have road safety is one of our concern. And third would be part of our national advocacy, our outreach programs. We are here to give our full support, and we would like to help in crafting a national surgical plan. Kasi kung titignan niyo po, through the years, it's been public health, no? And siguro pediatrics, medicine, and OB/GYN concerns, but we never talked about surgical care. And ang PCS po, Philippine College of Surgeons, nandito po kami para tulungan dahil meron din po kami mga projects like manpower studies. We have mapped out through the country saan po ang located ang ating mga espesyalista, saan po ang lugar na nangangailangan ng espesyalista. Of course, meron po bang facility. So it's very important po kasi ang structure where we can operate. No? So sometimes hindi lang po yun. We need anesthesiologists. So these are the concerns that we can help together with the Philippine College of Surgeons. So we have formed the SURE Commission. Kasama ko po dito si Tito Bert. Supporter po natin siya dito. And through Dr. Azores, we're doing outreach programs po to the underserved regions. Ito po yung mga national advocacies po ng Philippine College of Surgeons. And we are here to support our dear Secretary. But na-realize ko rin, tama po, amongst ourselves, we know what to do. Unfortunately, we do not communicate to the public.
They don't know our advocacies. That's why we're very thankful for this opportunity because the media is here. I believe kaming yung sinasabi ni Secretary po yung conduit. So as for us to know where the problem and to give solutions, but we need the media. So I think this would be a good opportunity kung papayagan niyo po kami. We are here po. We are here. Our Secretary, Dr. Dopitas, is here. He's a cancer expert. Through the 8-point agenda po, we can help, nakita ko sir, in 3 aspects po. Cancer care, trauma, and then the access to surgical care. Nandito po kami.
Well,
Salamat po.
thank you very much, Dr. Juby Villaflor. Let's give him a big round of applause. And now, even if I have so many questions in my head, but we will ask members of the media who are present here covering this Kapihan sa Manila Hotel. This is now your opportunity to ask questions. You can, yes, yes, please.
Please identify yourself and your organization.
Hello?
Go ahead.
Sec, hindi ito tungkol sa Chacha at sa People's Initiative. Sir, yung sa Bakakay Albay, meron daw 1 million worth na medicines sa Rural Health Center ang nag-expire. So bakit po nangyari yun and ano pong mga measures natin para hindi na po ulit mangyari ito? Thank you.
Thank you very much. Alam mo, ano yan symptom yan ng isa sa mga problem. And related yan dun sa stock out. Meron kang stock out, tapos meron ka namang gamot na nag-expire. And this is important kasi ang nakalagay dun sa news, some of the medicines were given daw by the Department of Health. So kailangan, yun yung isang pinasok. I want to modernize the asset management system of the Department of Health. Bakit? Kasi ang Department of Health, yan ang nagbibigay ng mga bakuna at mga gamot sa mga local government. Kung yung binigay namin gamot, natambak lang at nag-expire, sayang yun. Ang daming nangangailangan. So, yan, logistics expert si Mr. Lina. Tama yung direction ko, di ba? Nag-thumbs up ka agad siya. I want to modernize from procurement all the way to delivery. Di ba dinidescribe ko yung coke, yung soft drink, yung beer at yung sigarilyo, nandun sa pinakamalayong, kasi ayos yung kanilang logistics and supply chain. So, ganun lang ang kailangan ko ayusin sa Department of Health. May pera, di ba? Sabi ko sa'yo, third highest budget. So, ang kailangan ko lang talaga, makadating siya dun sa nangangailangan. At yung bakuna, hindi mabulok dun sa refrigerator at ma-injection sa bata. Ang expertise niyan, hindi medical. Supply chain and logistics expertise. So, nakipag-usap ako kahapon kay Mr. Charlie Villaseñor. Isa sa mga experts at nagbibigay ng training kasama ng aking supply chain management system. So ito siguro mga news na magandang pag-usapan. Kasi yun yung sagot dun sa bakit tayo na-expirean sa Rural Health Unit. Hindi dapat nangyayari yun. Shouldn't ever happen. Ganun din. Kung may balita in the past na some stores, dumami pera ng DOH. Walang storeroom kasi bawal kami magtayo ng warehouse kasi daw hindi healthcare facility. Ikokowa kami pag ginamit namin yung budget for non-health. So yung warehouse na maliit, pinupuno ng lahat ng delivery. In fact, pinipigilan pa yung magdi-deliver na nanalo sa bidding. Huwag mo na mag-deliver, puno pa eh. Dadalhin pa namin. Alam nyo, puno ng puno. Later on, pagtanggal mo ng mga gamit, ay may nag-expire tayong bakuna sa likod. This is third world logistics supply chain. I need to modernize this. Hindi to acceptable sa akin. Yung kinukwento nga yung stock out sa akin na hindi umabot sa mga TV doon. Sabi ko, walang hiya. Kami surgeon eh. Pag pumasok kami sa operating room at sinabi sa akin ng nurse, hindi ko kayo makaka-opera ngayon. Walang suture at walang gasa. Ay, magmumura yan. Mag-aalboroto yan. Kasi to prepare that patient to the operating table and everything, ang daming kailangan gawing logistics. Tapos sasabihin mo sa akin, ngayon naka-schedule, wala yan. Hindi po pwede yan. That's a failure. To me, that's a failure. When drugs expire, that's a failure. But it's more complex than that. It needs more expertise. And I'm calling on the logistics experts to help me out on this one. May isa pa ako i-comment. Naisip ko yung nagsasalita kanina si Juby.
ang gusto kong mangyari sa media, di ba sabi natin dapat, sabi niya health ang number 1 sa budget. Sabi mo, education and health. Ang gusto ko, ang binabasa at pinapanood ng mga tao, hindi yung political news, yung health news. Pag nagawa niyo yun, happy na ako. Bababa na ako as Secretary of Health. Kasi, yun, ibig sabihin nun, the individual will take care of his health. Binabasa niya yung health news, yung what is good to eat, when to exercise. Tatlo lang yan eh, di ba? TED yan, TED. Tamang pagkain, exercise, at disiplina sa sarili. TED, TED.
Mabuhay si Ted. Secretary, number 2 dun sa linya mo is, agenda mo is nutrition, no? Okay. Pwede bang masasabi ba na maraming sakit dahil nga dun sa malnutrition, particularly in the first 1,000 days? Kasi ang mga nababasa ko, malnourished ka in that period of time, poor school performance na. Number 2, sickly yung tao. Kahit na mag-survive, sickly na. Number 3, yung sukat at timbang ng bata, mababa. Pang-apat, low productivity, economic productivity. According to World Bank,
Sakitin, lagi absent yan.
51% lang ang kapasidad for economic productivity ng tao na malnourished during the first 1,000 days. At nung last Saturday, sinabi ni Dr. Marcy Atienza, the Dean of the College of Medicine ng St. Luke's, na yung earning capacity noong well-nourished is 21 times higher than a person who was malnourished during the first 1,000 days. So, binalik ko lang sa nutrition, yung mga sakit na cancer, diabetes, may tuturo mo ba yung dahilan din yung malnutrition?
So, ikukwento ko, dalawang example ko dyan. At mahilig ako magkwento. Napanood ko yung video clip from the Blue Zones. Napanood nyo ba yung movies? Hindi ko pa napanood yung movie, pero napanood ko yung isang video clip. It was about Costa Rica. And Costa Rica is a middle income country. Pero their health indices are comparable to Japan and the US. Longevity, 85. 80 yata, tapos 85 sa Japan. Tinanong yung health minister kung anong sekreto nila. Alam mo, house to house lang, dalawa lang in-emphasize nila, nutrition and dental health. Related din yung dental sa nutrition. Kasi kung pinakabungi-bungi ka, tayo, we have the highest number of dental caries in the world. Taas. So, yun lang ang pinokos niya. Longevity high. So, local story naman. So, that's one story, Costa Rica. Kaya tama ka, nutrition. Number 2 story, si Secretary Benhur, sabi niya nung mayor siya ng Mandaluyong, ang taas ng malnutrition. Pagkatapos sila ang pinakamababa sa public school system. Nag-implement siya ng feeding program. Nutrition. Naging silang number 1 sa public school performance. So, related talaga yung nutrition sa performance sa education. So, balik talaga. Basics yan. Kaya number 1 ko, bakuna. Vaccine preventable death. Patay ka kasi kung wala kang bakuna. Mamamatay ka. So, the next one, number 2, is really nutrition. Science-based po yung sinasabi ni Senator Lee.
Okay. Other members of the media? Okay.
Sec Ted, anong action nyo doon sa nangyaring expiration na yun? And sino bang magiging liable doon sa expire na
Local government yun eh. Remember, this is a local government. So, I think tinanggal na nung mayor yung, sino ba, governor ba? Basta, this is a local, masasagot mo yan. Ano ba action ng mga local health official pag
Ano yung warehouse? Sino may-ari? The mayor. The mayor, because health is an evolved service. Yung health officer, municipal health officer, is a local government employee. Okay. So, it's a local concern.
I think someone was fired. Dun sa news parang may finire na yung local officials. So nag-action yung hindi DOH ang mag-action na because our supervision is just supervisory kami. We have no direct control over this rural health.
Technically, it's the mayor, actually. The DILG secretary can exercise moral suasion, but the technical or the legal action can come from the mayor. Because government, local employee yan. Right. Any other question? Please. Okay. Mr. Bert. Bert Lina.
Aga po sa inyong lahat. As always, Secretary, we act on top as far as we are concerned. Ang tanong ko lamang...
Can you fix?
Ito lang, sandali lang ito. Yung first 1,000 days na talaga advocacy ng aking kapatid na tinutulungan namin, kami sa private sector, we're really rallying. Sa matter of fact, sa amin, simula pa lang sa pagkabuntis, sinisimulan na namin i-track down hanggang doon sa pediatrician delivery, di ba? Nung bata, si Raul naman, isa sa mga consultant namin. Ang tanong ko lamang, meron na po ba kayo ngayon na magkano ho ba talaga ang magagastos yung real thing na mula pa sa pagbubuntis hanggang sa maideliver yung bata at maging 2 years old? Do we have an estimate already? Para po dun sa funding, masabi lang po natin, oy, mga kasama namin sa private sector, pondahan na natin ito, tulungan na natin ang ating gobyerno, tulungan na natin ang ating bayan. Baka ho pwede nyong pasabi dito sa ating mga kasama. More or less po hanggang sa ipanganak at gagastusin ng 2 years old.
That's a very good question and I will have my staff, Dr. Domingo, compute natin. Kasi we can compute natin the prenatal visits, the vitamins for the pregnant, the ultrasound, di ba? Compute natin all the way to the first one, the immunization of the child, di ba? Breastfeeding and everything. We can have that computed. Most of it siguro dapat subsidy lang kasi the government is spending for it eh.
Hindi, sa amin ho kasi sa private sector, we're already, I'm doing it now. I'm making my mandate to all our companies na supportahan na ho ito. Para lang talaga tulungan at makita.
Ganda niya.
Whatever it is sa other side of midnight, bahala na ho kayo doon.
And that's correct because that will make me get my target faster. Yung zero stunting. Kasi if that happens, abay, next year dapat zero na yung stunting natin. Lahat ng Filipino children
Yung lahat ay papakain. Hindi na
tama.
stunted. We will share with you from the coalition's research because we're in touch with the National Nutrition Council. I-standardize nga kasi iba-iba yung approaches eh. Iba-iba yung approaches na i-standardize na rito. It's about within a year about 45 to 50,000 pesos. If you include all the expenses, the visit, etc. But kung naman may iba namang services rendered by other agencies. Yun lang itatrack down kung saan sila pwedeng pumunta. At saka libre yung folic acid,
Libre yun.
yung other
Siguro dagdag ko
vitamins,
lang na-
vaccination.
Okay, I know he's thinking from the private sector mentality, which is good, no? Pero gusto ko ipaliwanag sa media, the last time the Rotary and the Department of Health partnered, successful. Alam niyo ba kung ano yun? Polio eradication. Nawala ang polio sa Pilipinas. We are polio-free up to today. And that because all the Rotary clubs helped in some way or another get the oral polio in every child, every Filipino child. If we can do that with polio, with the patak, we should be able to do this with nutrition. I think we can also zero the rate. Pwede ko na gawin target yan. Sa lakas ng private sector support, I can target by in 1 year or in 2 years, zero stunting among Filipino children.
Last story. Kasi pagdating dun sa nutrition, alam nyo, kargador ho ang kaibigan nyo, Ted. Di ba? Kasi yung nutrition, yung gulay, prutas, etc. Paano natin, tsaka yung bigas, paano natin talaga maibababa yung presyo?
Okay, ganito ang ginawa ko dyan. Tutulong na rin ako. Alam niyo ba ang bago kong utos? Inuutusan ko na lahat ng hospital director ko at lupa na hawak ng Department of Health na magtanim ng pagkain, to plant food. At yung walang lupa sa taas ng building, gusto ko ng vertical farms ng vegetables and food. At in fact, ang feeling ko, yan ang kailangan natin gawin. In all government agencies, baka dapat ang daming lupa ng mga state universities and colleges. If we plant food, na-prove na to. Singapore, meron silang mga plant sa building nila then we plant food. Ang plano ko nga, pag ginawa yun sa aking DoH hospitals, ipamigay nyo sa mga pasyente at gamitin ng mga community around. Pwedeng yung in front of St. Luke's, may isang garden na yung mga doktor nag-aaral ng plantita. You can plant food. If we plant food, we can also provide food for the community. Nutrition ito. That's why I'm pushing the DoH to use its excess land to plant food because of my emphasis on nutrition. Simple lang.
Yun ang sinasabi ko kasi, Secretary, we deliver 30% of the seats in this country. So kung kailangan nyo makausap ang East West, Drago at saka yung mga kumpanya, I will ask them to see you.
At yung nagla-lab for all kami, yung DA namimigay ng seeds. Seeds ng gulay. Seeds ng mga leafy vegetables.
And the last one, yung sinasabi niyo sa RHU, yung expired. Kasi kami nagdi-destroy yung expired medicine doon sa aking pyrolysis. Doon dinidestroy. Pati yung shabu. Si Joey nandun, libre sa amin ng shabu, dinudunay ko lang. Kasi hindi po pwede. But the key here,
Libre ang sunog.
libre yung sunod. Oo, kasi baka mamaya maubusman kami. Kaya dinudonate ko na lang yan. Totoo yan. Yung tanong niya, kasi ang problema ho dun sa RHO, kasi na-devolve. Kailangan na ho tulungan natin kasi wala ho silang system. Meron na ho kami binigay na system sa isa sa mga RHO sa Cavite. Yun hong inventory system. Kung tatanungin nyo, I am donating the inventory system software to the whole country as of today with you around. Thank you.
Okay.
Thank you very much. News yan headline yan. That will fix my problem. Gawin, mag-usap tayo kasi I will fix my asset
I will
management.
sign it in front of you.
Thank you so much. Naku.
Alright. Thank you. Please.
Sir, good morning. Sir, Gerard po from Malaya. Sir, with regards dun sa Philhealth, you mentioned na you're in support of suspending the increase. Will you make your position known to the President po?
I already did.
Ano pong response niyo, sir?
I just sent it yesterday.
And sir, kung in favor po kayo ng suspension, when do you think it will be the best time para ituloy po yun? Or you think hindi na po kayo nakakatuloy?
If ever the President will agree to the continuation, my recommendation is to start from where we stopped, not the current 5%. So if we stopped at 2 or 3% increase, we stop at where it was suspended. That to me is the logical way to lift the suspension. We don't jump to a very high kasi kawawa yung mga tao.
So sir, for example, 4% po ngayon, next year, 4.5.
4% ngayon, 4 and 5%, pareho lang naman 4.5 and 5. Pero nasuspend siya at 3, at 4, from 3%. So I'd go to 4% lang, not 5%. 4.5 na tayo ngayon. So ang balik ako sa 4.5, not at 5.
Thank you, sir.
Okay. Any other question? Please. Members of the media? Yes. Please, you're recognized. Yes, the lady. Okay. Again, please identify yourself.
Good morning, Senator and Secretary. I am a journalist since 1989 with the broadsheets. I will not name the broadsheets. I've been covering the business sector and the agriculture. The problem with is there is no coordination between the different government agencies. Why don't you collaborate, coordinate with all the agencies like agriculture, health, transport for the logistics, because it's very hard. And also, di ba may pera dapat for the benefits, social work, something. Hindi ba pwedeng all the children from since birth up to they reach 2 years old, magkaroon from the government directly to the parents? Yeah, from since conception. Para talagang ma-sustain yung first 1,000 days na ina-advocate ni Senator Lina. Thank you very much.
Thank you very much. I agree with you. There should be coordination. But I disagree with you that there is no coordination. Because we meet all the yung coordination. Usap-usap kami lagi dyan. That coordination, siguro, I think ang difficult part is really handling it in the ground, because in the ground, there are certain restrictions of how these agencies work together. But at the leadership level, coordinated yan. Isang lingon lang ng presidente, pagka tinignan niya yung social worker, lilingon siya sa health, lilingon siya sa DILG, lilingon siya sa NEDA. Tapos lahat yan dapat pare-pareho ang sagot. So everything is coordinated. We have a National Economic Development Plan. Andiyan dyan lahat yan. Just like any game, like say, play sa basketball, kung minsan, hindi mo matupad yung play dun sa actual game. So I think that's where we need to improve. And tuloy-tuloy naman yan. The government continues and tries its best to do coordination. Ang maganda ngayon, I think I've been in government for a long time, 40 years na. In fact, nakita ko na mas maganda na yung coordination ngayon because the issues are like for example, nutrition. Di ba ang nutrition kasali ang DepEd, ang DSWD, ang DOH, ang DILG. So nakikita na ng mga ahensya na kasali siya. Nag-umpisa to nung panahon niyo, yung tinatawag na clusters, social clusters, ang nag-meeting lang ng cabinet. Tinuloy yan up to now. We call it the sectors. Ngayon ang tawag sector. So I actually sit down in cabinet meetings with those partners, DSWD, DILG, and pati DTI at DA sumasama.
Okay, follow-up.
Follow-up po. Ang problema pala sa barangay level, sa grassroots. Kasi yung implementation, from the top, okay kayo. Then when it goes down, yun na nagkakaroon ng problema.
Correct.
How do you resolve that?
It's always implementation. You see, ganito yan eh. Alam mo, natutunan ko to kay Secretary Galvez eh, nung boss ko siya sa NTF sa COVID. Alam mo, wise din to mga PMA graduates. Sabi na, Dr. Herbosa, your first casualty in battle is your plan. Kaya kahit anong ganda ang plano namin sa cabinet level, the proof of the pudding is how it is implemented at the local level. Tama ka doon. You're so correct in that. And it's a trial and error thing. Hindi siya ganun. In fact, yung mag-work sa isang LGU, hindi mag-work doon sa isang LGU. Mag-work sa isang isla, hindi mag-work doon sa isang. So, ang tingin ko nga dito, we need to actually look at setting, make sure it's not dictated by us. It should be ground level and then appropriate yung plano and coordination at the local level. So, very important, think national but act local, diba? Para maganda talaga.
Okay, any other question? You see, Secretary, the beauty, yes, please.
Go ahead.
Go ahead.
Ayun na po.
The beauty of this discussion is you're able to communicate to the members of the media and therefore to the public. The impression being created kasi, if you do not know what's happening, is that there is nothing happening. Di ba? That's why when I was in my teleradyo program, I made sure that the government is able to communicate its programs and projects so that the public will understand that something is being done and not be caught in this lack of information, therefore nothing is being done. So that's why the purpose of the Kapihan sa Manila Hotel is precisely to be a venue for leaders of our country, private and public, to be able to Okay?
Just to add to that,
Yes. Go ahead.
Senator, just to add to that, sa tingin ko yun ang problema yung communication. So, ito po yung role ng media. At the same time, nandito po yung PPP na papasok, yung private sector. Siguro makakatulong din po yan sa kakulangan ng kung ano man sa grassroots. Ang problema po natin is talagang mahirap po kasi we are 1,000 islands. It's how to bring the plan, the implementation to our community. So that's the challenge. So I think we should help each other. So we are here through the private sector, the media, and government. Makakapagtulungan po tayo to bring all these plans to our community.
Okay.
Hi, sir. Rafael Bosano po from ABS. Sir, I just want to clarify your position on the Philhealth hike. So you're not in favor of the 5% hike, pero kung sakasakaling gustuhin man ni Pangulong Marcos na mag-increase, it will have to be at 4.5, which is the 2023 suspension.
So my position is, I think PhilHealth has enough money to actually continue to give benefits, and it will not be hurt by delaying the increase in premium. I need to see actual good actuarials on this one. So you need to have science-based to do the policy, hindi yung whim na itataas mo lang. There are other things that are supporting healthcare. MAIP is one of them. I was given an additional 40 billion. So you have to look at the big picture. It's not only PhilHealth. Meron yan. Tapos our economic wealth is also increasing. Most of the citizens are also able to afford private healthcare. So the other things I need to do is lower the price of medicine, lower the price of consultation, maybe telemedicine. So madam, hindi lang PhilHealth ang pinag-uusapan dito. It's a whole health system reform. So kailangan tumingin tayo gano'n, no? When you write about health parang ano yun sa post, it's complicated. It's complicated. It's a systems approach. Though I'm a systems thinker and an operations thinker. I don't look at one problem kasi ang field ko disaster medicine. Madaming moving parts. So you don't look at a problem as well just the rate. It's a whole system. So ang ini-espouse ko is health system strengthening. And that involves health financing, premium payments, cheaper medicines, yung sinasabi niya, yung implementation at ground level, very good plans of government. If we start to look at the health system this way, we can get the health system the Filipinos deserve, which is a strong health system, maybe probably similar to European socialized healthcare models. Because I think yun yung na-envision ng mga nag-frame ng PhilHealth at nag-frame ng universal healthcare law. They want a healthcare system similar to what socialized countries give. That from womb to tomb, bahala ang pamahalan sa'yo. Basta magtrabaho ka, make the country rich. If you get sick, we'll take care of your open heart surgery, we'll take care of your liver transplantation, we'll take care of it. That's what Singapore does. That's what UK does, Germany, Scandinavian countries like Sweden. We want to go there, but it's not an overnight thing. It's a work in progress. And itutuloy ito ng people who will succeed me. In fact, iniisip na namin succession plan sa health. Kasi hindi siya matatapos if we put another politico in the health department. We need to get technical people who will continue the work in health system strengthening. That's the story of the health system.
Okay, thank you very much. Palakpakan po natin si Secretary Ted Herbosa at si Dr. Juby Villaflor. Palakpakan po natin. Mas malaki at mas marami at malakas na palakpak sa members po ng ating media are present here. This is one of the more interesting Kapihan sa Manila Hotel. Secretary Ted, and the presence of the media is overwhelming. I've never seen as many cameras present here. So, is Secretary Coloma here? Nag-break. Okay. Physiological break. So, any question? One last question, because the Secretary and as a busy schedule. One last question. from, please identify yourself.
Hi, Sec. GC po from PD5. Sec, just to clarify yung binanggit nyo kanina, so may inilabas na bang cease and desist order doon sa clinic na involved?
Wala pa, pina-investigate ko pa lang kung license siya, kung anong totoong nangyari. So, fact-finding pa lang.
Okay. All right. Well, I have no choice but to close the curtain formally over this Kapihan sa Manila Hotel. Thank you once again, Dr.
Ako po
Secretary Ted
magpapasalamat.
Herbosa.
Thank you very much for this platform. As I said, and as you said, and as Secretary Coloma said, very important ang health communications. I think we should actually help each other, magtulungan. I'll try to give you as much technical information as possible in the health system, yung ginagawa ng Department of Health. Pero sana tulungan niyo ako by communicating this very well to the people and to the people that will need this information. Maraming salamat. Thank you very much.
Thank you very much. You're very much welcome. Dr. Juby, just a few parting words.
Maraming salamat po, and nandito po ang Philippine College of Surgeons to support the Department of Health through all these projects, especially the 8 Points program. And we would like to thank Manila Hotel, Kapihan, and we would love to be part of this Kapihan regularly po. And we will bring all the specialists as regards to your surgical concerns and to answer the concerns of our community. Maraming salamat.
Okay. All right. Maraming salamat. We now close this Kapihan sa Manila Hotel, Secretary. Okay. Just final words after your side.
Tinisignan ko po yung ating screen, yung petsa January 17, 2024. Siguro tatanong ko na lang sa background. 4 years ago, the same date, wala po tayong kamuwang-muwang na papasok tayo sa isang hindi lang oras de peligro, kundi 3 taon ng peligro. Yun ang pandemya. So siguro naman po dahil sa mga narinig nating paglalahad ni Secretary Ted Herbosa, siya po ay may malalim at malawak na karanasan sa aspeto ng pamahala sa ating sistema ng kalusugan. At ako po ay nananalig na sa ilalim ng kanyang liderato ay matutugunan natin ang kung anumang sitwasyon ang ating kakaharapin. Lalo na kung pagtutulungan po natin ito, yung media, citizenry, and the civil society. Dahil yung kalusugan po talaga is the whole of country concern na dapat po natin pagtulungan.
Okay. Maraming salamat. Maraming salamat po sa inyo lahat. Okay. Meron tayong bigyan ng kaunting alaala.
We can end already.
Meron po.